Hi, I'm Melissa Pye, Program Manager for the UNSW Founders flagship 10X Accelerator Program. Together with Best A&A and Vesna Todorowski, Program Managers of Health 10X, and supported by Nancy Torres, we are all super excited to welcome you to celebrate the extraordinary achievements of our 12 startups who've just completed our 10X and Health 10X Accelerator Program. First, I would like to acknowledge the Cammeraygal people that are the traditional custodians of the land I stand on. I also acknowledge the traditional custodians of the various lands from which you are joining today. I would also like to pay my respects to the elders, past, present, and emerging. The UNSW Founders 10X Accelerator was launched in 2018 to support high potential startups founded by UNSW students, staff, and alumni. In 2019, we partnered with the George Institute for Global Health to launch Health 10X and haven't looked back since. This year, we received over 100 applications. Of these, 50 teams were invited to participate in the 5-week pre-accelerator phase. The most promising 6 industry-agnostic startups and 6 health-focused startups, who you'll see tonight, went on to participate in our 10-week accelerator program. The intensive programming delivered was designed to provide our founders with the knowledge, skills, and networks to accelerate their growth, attract customers, form partnerships, and become investment ready. Last week, that culminated in our demo night, where the teams pitched to and met with a targeted group of potential investors. Off the back of that success, we are thrilled tonight to showcase the teams to our founders community. We are so thankful to many of you here tonight, our amazing speakers, mentors, pre-accelerator participants, supporters, founders, family, and friends. It is through your generosity and support that we're able to do what we do and provide one of Australia's leading entrepreneurial programs. To kick things off, we'll hear an opening address from UNSW's President and Vice-Chancellor, Professor Ian Jacobs. We'll then move into the pictures from our 6 industry-agnostic teams before sharing a short overview of the journey our teams have been on. Next, an introduction to the Health 10X program, and we'll round that off with the pictures from our 6 health teams. We hope you enjoy the showcase, and to get us started, let's hear from our very own Professor Ian Jacobs.
It is my great pleasure to welcome you to the Founders 10X and Health 10X Accelerator Demo Night 2021. Demo Night is one of the most exciting events in the university calendar, and that is a pretty big call in our thriving university. I make this bold claim because Demo Night not only demonstrates 12 inspiring startups and their brilliant ideas, but also 2 concepts that are central to UNSW's mission. The first is collaboration. Tonight is the culmination of the powerful partnership between UNSW Sydney, the George Institute for Global Health, UNSW Entrepreneurship, and the 12 teams of founders who will deliver their pitches. And I offer particular thanks to the George Institute for the special partnership we share. Your global health expertise is invaluable. And secondly, the focus of this initiative is to improve lives on a global scale, a motivation that underlies all we seek to achieve at UNSW. Seeing it brought to life on Demo Night as our 12 teams unveil their brilliant ideas and ambitious visions is truly inspiring. Collaborating for global impact has never been more important. As we look to emerge from the pandemic with a strong society and economy, now is the time for our innovators to shine, to contribute to the next wave of growth. At UNSW, we take pride in supporting Australia's entrepreneurs. Our world-class education and research networks provide the bedrock upon which our founders' teams can flourish. When we invest in startups, we provide much-needed early-stage funding and help steward our entrepreneurs from inception to high growth and impact. And this investment is bearing fruit in a broad range of entities. I remember Farage, who pitched their virtual work experience at our very first demo night. They've recently raised a $35 million Series B round of funding, bringing their total funding up to $48 million through 2 funding rounds in the past 18 months. Another UNSW startup, High Earth Orbit Robotics, has become the first private company to successfully inspect satellites in space, and they've just been funded by Y Combinator. And Cardio Bionic, which developed a low-cost device to save the lives of people with late-stage heart failure, is currently fitting out a pilot manufacturing plant. These are just some of the many 10X and Health 10X alumni startups that we're so proud to celebrate. Tonight, we have the privilege of seeing 12 more top innovations begin their journey from inception to global impact. We welcome you to share in their success both now and well into the future. I hope you all enjoy the spectacle of Demo Night 2021.
Thank you, Ian. It's now time to see our industry-agnostic teams pitch their innovative solutions. I'm pleased to introduce Assurance Lab, the Hiking Club, VidUp, @One, Unicorn Shift, and Look Before.
In 2021, trust is under threat. To do business, you need trust. It inspires action that creates value and drives growth. How do we manage trust? There's a $400 billion industry used by big business to create trust, and that's audits. Let's look at an example. Here's Brian, who runs a software business. He needs to prove that his software keeps data secure so that he can win large customers. But he's got a problem. A consultant quotes him $250,000 for the audit. Not only is that expensive, it's going to upend his business for months, and he's got no idea what he actually needs to do for it. Businesses like Brian's either suck it up and go ahead anyway, or miss that opportunity for growth. Why is it so expensive and painful? Well, it turns out audit firms focus on the big companies with an expensive, high-touch and non-scalable audit process. How do we know this? Erica and I were these consultants. We met many great businesses like Brian's, unable to afford our services. So we asked ourselves, what if audits could be more affordable? What if clients could self-serve and do it in their own time? What if audits could be automated? That's what we've done at Assurance Lab. We digitized the audit. We built a product over 3 years with data from 450 businesses and over 100 live audits to automate the thousands of data and decision points previously requiring teams of consultants to work through. And it turns out there's a massive market of these smaller businesses outside of the top 1%. So where are we today? We've reduced the cost of audits by a factor of 10, and our customers, would you believe, love audits. Our key metrics are great. We've got less than 10% annual churn, 126% net revenue retention, and dozens of partners with 33 referrals in just the last 10 weeks without any kickbacks. Our customers and our partners want more from us. We reached 2 million annual recurring revenue, adding 575,000 in the last 10 weeks. We have active customers in 10 countries, including Europe and North America. We added 3 audit use cases this year that already make up 25% of our new revenue. Now that we have the platform, we're looking at new areas where audits and trust are needed. That's saving our planet. Environmental, social, and governance are this huge new area that businesses need our help with. The best bit is, nobody else is doing it the way that we are. So who are we? We're a B Corp, purpose-built and tenacious about our vision. We're experienced auditors and innovators, a very rare combination. We've proven ourselves with a profitable, capital-efficient, and fast-growth business. So in summary, we already have the product, we already have the profitable and capital-efficient business model, we already have customers that love audits. Now with your investment, we can roll this out to meet the world's desperate needs for trust. In 2021, trust is under threat. We're democratizing audits to build trust.
Hi, I'm Brendan, co-founder and CEO of the Hiking Club. We believe personal hiking experiences have the power to transform lives. We empower you to walk the way you want in the wild. We do this by making your perfect hike easy to find, quick to plan, and simple to navigate. Today, finding the perfect hike is hard. We all crave rich personal experiences in the wild. but our only option is to choose from the same list of hikes that national parks and guidebooks tell everyone to do. When it comes to planning, we think this should be fun, but the reality is the process is frustrating, confusing, and filled with uncertainty, but not anymore. Our solution turns trail information into a range of personalised hikes that takes into account your preferences, fitness, and interests. We give you everything you need to make planning a breeze. On the trail, real-time tracking will notify you of upcoming water refill points, while gamified challenges encourages interaction with the hiking community. We are building a global hiking brand that empowers you to walk the way you want in the wild. Our MVP focused on core functionality required to personalise a hike. Customers create a personalised itinerary, then receive key planning information for easy preparation and a GPS map for confident navigation. We launched this MVP on one multi-day trail in the Alps to determine how big the demand for personalisation was. 500 hikers from around the world used our product, with 95% choosing a different itinerary than the one offered by the guidebook. We've since added 2 new trails nearby, and despite COVID holding international travel back, we've achieved $50,000 in total revenue. During the 10X Founders Program, we ran a pilot in the Alps to determine if there was also demand for day hike personalisation. In just 3 months, we've attracted 500 new customers to our solution, with 90% choosing to personalise their day hike. Demand for our day hikes opens up a mass market opportunity, with 120 million people across the developed world going hiking each year, who we can empower with our solution. The Hiking Club model currently earns $50 per hiker for each package sold via our website. Customers use our products to self-guide their way through the planning process and along the trail. As we grow our day hike volume, we will introduce a subscription model too. Our go-to-market plan targets casual and active hikers from around the world with inspiring, informative, and fun content that our growing community has influenced and contributed. It cuts through the noise on otherwise crowded social, organic, and paid channels, delivering us over 5,000 followers and new set of subscribers to date. Our core team has known each other for nearly 20 years and hiked some of the most famous trails around the world. I have experience delivering global transformation projects and built the Hiking Club solution. Greta's business development and design background has brought new customers and partners on board, and Susan advises on marketing and strategic initiatives. In 12 months, the Hiking Club will be the leading global community for hikers, with personalised experiences in destinations across the world. We are seeking investment and partnership opportunities to accelerate our growth. If you love adventure, join us on our journey.
The need for videos to inform, entertain, and educate has exploded as the move towards online engagement has accelerated, propelled by COVID-19. Hi, I'm Jason, a student entrepreneur at UNSW, and during my study, I uncovered a critical need for rapid video creation for students, lecturers, and tutors. The problem is, video creation is hard, it's time-consuming, and can be really expensive if outsourced. That's where VidUp comes in. Simply upload a script and then decide what type of video you'd like to make. Are you looking for an informational video? Do you want to have a happy tone? What platform are you producing this content for? What type of branding would you like to use? Once you're ready, you can have a video in front of you in under a minute. What would have taken over 5 hours to create takes only a minute. We also take care of the little things that matter a lot. Through image and video recommendations, users can make adjustments to their videos. You don't need to be an expert to create a stunning video. You can leave that to us. There's a huge opportunity for our technology. Firstly, we'll work with the higher education market with over 25,000 universities needing cost-effective video creation right now. We will then address the 200,000 SMEs who need to engage with their digital audiences to grow. And the 2 million businesses need a new way of creating videos in a fraction of the time. Many of our competitors are focused on the advertising market, and the videos they help produce are completely different to that of VidUp. We're all about informational videos, and they require a completely different set of tools. Unlike others, we optimize for information. We're currently working with the UNSW Business School, have over 127 students creating videos, and over 6 student societies using VidUp. VidUp is a SaaS platform accessible to anyone online. We're using a freemium subscription model to grow our user base. Through social media marketing and referral programs targeted at young people like us, we'll expand our reach and get people excited about videos. Our community accounts will have VidUp branding. This means thousands of people every day will see our logo. This will also help us monetize our platform. Our vision is to democratize video, and we will do this through our deep understanding of AI and commitment to design. So next time you need to create a video, don't waste time and money. Use VidUp so you too can create a video just like this.
We're facing a mental health crisis that has a huge cost on society. Mental health issues can affect people's relationships, sleep, physical health and performance. And it also costs Australian workplaces $10.9 billion a year. In fact, 1 in 5 Australians take time off work each year for mental health. Over half of those people don't access treatment, some don't realise there's an issue, and others don't do anything about it. I'm Edwina, founder of @ONE, and I'm one of those people. Despite 25 years in the fitness and wellness space, I didn't realise how stressed I was until I found myself in an ambulance after collapsing from workplace stress. We all know what to do to keep physically fit. We measure and track our every movement with Garmin's and Apple Watches. But what do we do to keep our minds fit? Meditation's a proven methodology to help people reduce symptoms of stress and perform their best and improve their overall mind fitness. The problem is, many people find it difficult to meditate. It's hard to get into a deep space that's required to experience the benefits and to find the right space in the work environment. @ONE is a solution to supercharge the ability to meditate by combining ancient practices with leading-edge technology. @ONE uses immersive virtual reality technology to amplify the sensory experience and takes people into a relaxed space faster. @ONE combines sight, sound, and smell with over 30 original music tracks, real and virtual locations, and 5 categories of guided meditations to take users into another world of deep relaxation. The global mindfulness meditation app market has grown significantly from $270 million in 2019 to estimated $4.2 billion this year, with Headspace and Calm being the dominant players. What sets @ONE apart in this space is we use VR and are focused on the B2B market to make meditation mainstream in the workplace so people can have that safe space at work to de-stress and refocus. We've developed a framework to measure and track 5 key areas including focus, clarity, engagement, emotional function, relaxation and recovery. There are individual and anonymised group reports to give insights to help manage mind fitness, and we offer our subscription model from $500 to $5,000 a month for software and online training with as few as 2 headsets required. We launched in January 2021 and have done testing and pilots with various companies and sporting organisations and have secured our first customers. I'm surrounded by an incredible team of advisors with expertise in VR, branding, data and marketing, and I've been teaching meditation for over 20 years. If you want to be part of creating a mind-fit future, we'd love to hear from you.
Unicorn Shift orchestrates on-demand road traffic control. We're all driven by work sites and seen road traffic controls by the side of the road. It's a bit annoying having to slow down and wait in traffic, but these road traffic controllers play an absolutely crucial role in keeping you safe and ensuring work sites are safe and compliant. When a traffic controller doesn't show up for a shift, it is a massive problem, and that's because even a single unfilled shift means the work site is in breach of the law. Now, it's really hard to fill last-minute shifts. And on the flip side, there are a lot of underemployed, fully qualified traffic controllers. The reason for this problem is that websites like Seek and Gumtree, they just don't cut it. So when a worksite can't fill a last-minute shift, work must stop. And on a $50 million project, delays cost $50,000 per day. We are solving this problem with a 2-sided network that matches traffic controllers to nearby worksites. This is a massive opportunity. There are over 7,800 heavy construction companies, over 250,000 traffic control workers, and a SAM of over $1.3 billion in Australia alone. And this is a fast-growing industry. Traffic management firms are reporting 20 to 30% compound annual growth rates. We've got a broker fee revenue model. Our take rate is 25%. We add value by unlocking a huge vetted supply of quality road traffic controllers. We're also reducing costs for work sites. And that's because our traffic controllers don't have the overheads of traditional traffic management firms. And finally, we make it all frictionless. We integrate with the worksite's WHS function, and we manage all the payments. What that means is with the push of a button, worksites are fully resourced with high quality traffic controllers at the best rates. We beat the competition by being the fastest and most compliant. And that's absolutely vital in traffic control because this is a highly regulated industry that's ad hoc and last minute. Worksites can pop up at any place and at any time. This is a global opportunity. And excitingly, Australia is a world leader in traffic control. So we'll leverage Australia's leadership and our technology to expand to other markets, including the United States and Asia. We've got an experienced team. We've taken 3 traffic management firms from zero to over $6 million in revenue. My co-founder has almost 20 years experience in this industry, and we're advised by Mike Abbott, a founding employee at Uber. So next time you get stopped by a traffic controller, turn your annoyance into happiness by investing in UniCoinShift.
The last time you bought something online that was $500 or more, how many reviews did you read? How many did you trust? At Look Before, we are taking the smoke and mirrors out of online shopping, giving you confidence to buy while helping companies understand your needs better. E-commerce has transformed how we buy, but trust remains a major factor for if we buy. Today, we expect brand personalization, yet $832 billion a year is lost to digital marketing campaigns that miss their target. That means a lot of spam. It's also just harder for us to tell what's real. Last year, fake reviews influenced more than $200 billion spent by consumers online. These frustrating distractions erode trust, and attempts to better connect brands with buyers through surveys, website design, influencers, unboxing videos, you name it, it still leaves us with purchase uncertainty. Now, imagine hopping on a video chat at any hour with someone like you. You can ask questions that only a real owner would know about the thing that you're thinking of buying. Look Before wants to create these authentic connections between real people and bring the trust back online. In our more than 100 market interviews, it's clear shoppers just want to speak with people, not bots, to help ease their decision-making. To test this, we've been matching people manually and delivering a concierge service. This has shaped our app design, which will be automated and launched November 10th. Look Before is an app-enabled community that helps you find the right product for your actual needs by connecting you directly with a user advocate for their real product experiences. Below the surface, Look Before analyzes the conversation and search data, synthesizing buyer trends and product feedback into an insights dashboard to help companies improve and better connect their products to their target users. Among our competition, all depend on written or recorded user contributions, which crucially are one-directional. Look Before's strongest differentiator is at the core of our business, enabling authentic dialogue between real people. Our app is free for our users, so they openly share their independent, authentic product opinions. You can progress through your entire purchase journey up to the point of sale, and the product advocates you speak with are not rewarded on the positivity of their review, but rather their honesty and helpfulness. Our advocate program is a gamified point system which reflects the value brought to the community and keeps our most helpful reviewers engaged. We're monetizing our platform in 2 stages. First, through affiliate links on our app with an estimated 10% commission through click-through purchase. Once we reach critical user mass, we will add an insights-driven subscription model for partner companies. Our priority is building our community to the first 1 million users. We're starting with early adopters who are passionate about their purchases and dedicated to eliminating distrust. My co-founders and I are tired of wasting our time looking at irrelevant ads, reading unhelpful reviews. We have a background in customer purchase psychology and have been partners for more than 5 years. 3 of us are dedicated full-time. Anthony is a startup veteran. James loves all things data and insight. Mandy brings precision to our business process, while Kevin keeps us agile and out there. We've added 2 crucial mentors focused on technology and finance, and we would love for you to join us. We're opening our seed round in January. If our mission excites you, let's partner. Sign up for our progress updates and come speak to us in our breakout room. Let's disrupt the way the world shops online.
Congratulations and well done to our first 6 teams. It's been an incredible 15 weeks with over 60 program sessions, 30 coaching sessions, 70 mentor meetings, and 90 meetings with our entrepreneurs in residence. That's a lot of Zoom time. Here's a look at the journey they've been on. UNSW 10X and Health 10X 2021 saw 12 startups participate in the 10-week accelerator phase, where our focus was to get the founders investment ready. The team set goals and met each Monday to track their success. Every Wednesday and Friday, we ran sessions where experienced founders, investors, and domain experts shared their detailed knowledge and practical tips.
Some quick insights about what venture capital is all about and what's the best way for you to unlock the opportunities.
There might be times where you're like, you know what, this check is like, we're going to go bust. We don't get this check. But, you know, look at the fine print is really important.
So how do you raise capital? Try to consider this as a process. Track everyone you're speaking to, work out the right cadence for how you nurture those relationships.
Each team also met weekly with a carefully matched mentor, as well as our entrepreneurs in residence, who all help the founders by problem solving, motivating, and making connections.
The teams this year have just been phenomenal in grasping that guidance. And, you know, I guess as mentors and EIRs as well, we're able to connect them to people that they need to progress with.
These teams have been through so much over this investment ready program. We've taken them from here to become globally competitive startups.
Understanding the investment landscape, understanding that our business is good enough to get investors was a big learning for me.
I don't mess around when I talk to startups, I talk to founders. I give it as I see it, pretty straight. You know, don't hide behind vanilla. If you're going to be big and show big, and don't be ashamed of it.
Health 10X, delivered together with the 10X program, supports startups developing solutions for some of the world's biggest health challenges, particularly the growing burden of chronic disease. Now, in its 3rd year running, Health 10X is a unique partnership with UNSW founders and the George Institute for Global Health.
Health 10X harnesses the global health expertise of the George and the extensive entrepreneurship knowledge of UNSW founders to offer dedicated support for early stage health startups.
I wanted to give you a broad brush understanding of the regulatory environment for conducting clinical trials.
As a founder, one of the most important things that you can build up is your network. And that's something that Health 10X does really well. They know how to connect you to different people and connect you to the people that can actually accelerate your startup.
Met all kinds of people, broadened my network, made so much progress, yet I've done it all from my living room.
I think just being in the community of really supportive people, really impressive founders and things that have given us tips along the way, I feel much more prepared to take on the world outside of the program.
It's been an incredibly comprehensive program with more than 60 sessions. We also have fabulous speakers. We have more than 50 speakers and new initiatives like the Impact Award that created awareness about social, environmental, and financial sustainability.
Each year, UNSW supports thousands of potential new founders. Since 2018, we've supported over 60 startups through the 10X Accelerator process. And collectively, these 10X startups have gone on to raise over $70 million in new funding and have created hundreds of new jobs. The 10X Accelerator programs only exist through the generosity of our philanthropic supporters. In particular, it was the vision and support of Mr. Mahas Natambi and Dr. F.F. Wong that created 10X and continues to sustain the 10X accelerators. Our ability to nurture Australia's next generation of founders also relies on the mentors and speakers that volunteer in the program. Thank you to the over 100 people that contributed their time in this way. In particular, I want to thank Trevor Folsom, Chris Baxter, and Gary Zammel for their support. UNSW is using its resources and networks to support the next generation of startup founders, and I encourage you to do the same. Thank you again to everyone who contributed to the 10X and Health 10X accelerators this year.
Hi everyone, I'm Besta One, UNSW Founders Health 10X Program Manager. Tonight, along with the industry agnostic teams, we celebrate and showcase the 6 teams who were part of the Health 10X Program Accelerator. I feel so honoured to have been part of their progress, and I'm excited to see them go on and impact millions of lives as they improve healthcare here in Australia and globally. A huge thank you to our health startup founders. Your passion and commitment to improve healthcare and create an impact is so inspiring. To our mentors, speakers, the George Institute for Global Health, UNSW, and of course you, the UNSW Founders community. We would also like to thank the Australian Government Department of Industry, Science, Energy and Resources, and the MRFF Ready Initiative, whose support made Health 10X possible. Before the pitches commence, let's hear from Dr. Parissa Glass, Director of Innovation and Enterprise at the George Institute for Global Health.
The George Institute for Global Health is very proud to partner with the University of New South Wales, Sydney, to once again deliver this important program, Health 10X. The need for new strategies and ideas to combat the global health issues, whether be global pandemics or the silent pandemic of non-communicable diseases, have never been more apparent than today. As governments around the world work to immunise their population against COVID-19, we must continue to work to reduce the burden of non-communicable diseases, especially in vulnerable populations who might not be able to afford or access necessary care. And this is exactly the goal of Health 10X, to support the type of innovations that's required for management of global pandemics and many other diseases such as heart disease, cancer, kidney disease that kill millions of people prematurely every year. As you know, UNSW is Australia's most innovative university, and through this partnership here at the George Institute, we believe we have the platform that can support many important innovations to get to the hands of people who need them most and improve the lives of millions of people. Health 10X is a shining example of what a partnership of like-minded people can deliver. I'd like to take this opportunity to thank MTP Connect for their support through the READY program. For those of you who don't know, READY is a program focused on building the skills and experience required for Australia to support major growth in medical innovation sector. The initiative is funded by the Australian Government's Medical Research Future Fund, and we are delighted to have partnered with MTP Connect in this initiative until the end of 2023. Well done and good luck to startups, and thank you to all the mentors and supporters of this program, and thank to all of you for attending this session.
Thank you, Parissa. And now let's hear from our health teams. I'm pleased to introduce to you Neuroflax, Humane, Synbio, Alaso Bio, Otomi, and Pateo.
Did you know that every minute a stroke is left untreated, 1.9 million neurons die? My name is Sam. I have a neuroscience honours degree and I'm currently doing a PhD in biomedical engineering. At Neuroflux, we're developing an innovative device for stroke patient management. Following a suspected stroke, a patient will have a CT scan to confirm the diagnosis. Now, time is critical when dealing with stroke, but data from these scans takes time to be obtained. They provide imaging snapshots due to radiation exposure are only performed every 24 hours. In this 24-hour window, patients will receive treatment and are now at risk of having a secondary stroke, which further reduces the quality of life and costs approximately $620 million every year in Australia. However, there is currently no device for the continuous monitoring of brain activity and blood flow, which are key indicators in stroke. Standard care relies upon follow-up CT scans and nurses talking to patients, which is subjective. Neuroflux will fill this gap. We're developing a wearable device that will provide real-time monitoring of treatment and the detection of secondary strokes, leading to faster detection, intervention, and improved patient outcome. This will also reduce the number of CT scans required. Our multimodal wearable device provides real-time continuous monitoring of both brain activity and blood flow simultaneously. This is our unfair advantage. Our device will also have alert algorithms to assess treatment outcome and to alert doctors when the patient is deteriorating or may be having a secondary stroke. None of our competitors provide reliable long-term continuous monitoring of both brain activity and blood flow simultaneously. Our device will also be cheaper and more portable than our competitors. There are 150 stroke centres in Australia. Within our first year of sales, we intend to sell 5 devices to 20% of these centres, generating $750,000. We are also planning on entering the American and European markets, where there are a combined total of 30,000 hospitals. If we sell 5 devices to 10% of these hospitals, this will generate $75 million. Furthermore, with the ageing population, the incidence of stroke is expected to increase. The time is now to invest in brain monitoring technologies. Our initial foothold market will be in-hospital monitoring, where we'll sell devices and offer a subscription service for our software platform. There are also exciting expansion opportunities. Our device is scalable to ambulances and at-home monitoring, and due to the low cost and portability of our device, we're also looking at rural and remote areas where there is limited access to CT and MRI scanners. Our device may also monitor other disease states, including traumatic brain injury and delirium. David and I are the co-founders of Neuroflux. David has a PhD in medicine and is currently doing an MBA. We are supported by advisors with expertise in clinical care of patients, commercialization, IP, regulatory affairs and market access. Join us on our journey as we seek to improve stroke patient outcome in Australia and worldwide.
Hi, I'm Jatin, the founder of Humane. We help families easily manage disability funding and care. Did you know that by 2025, National Disability Insurance Scheme will cost Australians $30 billion. That's more than Medicare. But most of these funds are still managed manually by families or the carers. Like just last year, 59% of families spent less than 75% of their budget allocated and missed out on life-improving support. Some other families accidentally overspent and had to pay money out of their own pockets. 75% self-managed families were not prepared for government audits, and 65 hours on average were wasted on admin per year. You'd never dream to try to manage the accounts of a business without something like zero. So how can families be expected to when it comes to their NDIS budget? And that's why we've built Humane. Families can easily track their budget and detect overspending or underspending in real time. They can store all their spending and claims in one place, ready for any audits. They can plan for better care by using our unique budget planner. We have started automating the entire journey, so we can reduce the time taken to process a single service booking from 15 minutes to just a couple of clicks. With $0 marketing spend, we have learned from over 300 early users and received feedback showing we help families spend better, be compliant, and save hours every year. We turned Humane paid at the start of Health 10x at $200 per year subscription that families can pay out of their NDIS budget. And we've proven early need with over 4,000 in recurring revenue since then, doubling month on month. Also, rather than competing, we aim to help over 2,000 non-technical partners grow and be more efficient. We already have 2 paying partners and are co-developing pilots with them. Once we have successfully completed this, we have warm intros in pipeline worth $400,000 in ARR. We've also got an MVP grant from New South Wales government and have strategic investment from Cerebral Palsy Alliance with over 5,000 future potential clients. I was employee number 3 at an Aussie startup with multiple Fortune 500 clients over 26 countries and an eventual 9-figure exit. And I care about this problem because I've experienced it firsthand. Our team also has combined experience with over 5 consumer startups and hundreds of thousands of users. We're at the very start, but by 2026, we will be the place for families to manage their care, funds, and service bookings all in one place. And eventually, we can help families anywhere in the world. If you're interested, let's have a chat. Thank you.
We are Synbiot, and we are optimizing the processes used to produce and develop new biopharmaceutical products. As we all know from COVID, the ability to rapidly develop and produce novel biopharmaceuticals is essential for the prevention and treatment of life-threatening diseases. But despite this, there are many inefficiencies that are holding researchers back from developing the next wonder drug. Currently, in one cycle, the machinery used is only able to convert 10% of all raw material into a safe and workable form, with the other 90% having to be manually analysed and reprocessed until 100% conversion is achieved. This process is so labour and time intensive that simply discarding these precious unconverted materials is a common practice. This process is costing the drug manufacturing industry up to 80% of the production costs, meaning new biopharmaceuticals are not only taking longer to be available, but are also costing patients more. At Synbiot, we are developing a compatible control module that through automatic reprocessing is aiming to eliminate the need for manual analysis and reprocessing. Our control unit will be able to achieve this by automatically analysing raw materials in real time to automatically divert any unconverted material back to the start of the process, all in just one cycle. This has the potential to increase efficacy by 10 times, meaning more time can go into the actual development rather than troubleshooting. As a B2B, we'll be offering our machine direct to market through upfront machine sales and rental, as well as through licensing. We would offer the only machine that would be capable of both automatic analysis and reprocessing of materials. The biopharmaceuticals industry is worth $325 billion worldwide, with the global market for this process alone worth $8.69 billion and a compound annual growth rate of 16.9%. We aim to serve 0.9% of this market worth $78 million. Currently, we are developing our proof of concept hardware and software, with testing beginning in 2022 once lab access resumes. Through our KOL engagement in Health 10X, we have identified the benefit our technology can have in research and pharmaceutical R&D, where we aim to launch in 2023. And our ultimate vision? Accessible biotechnology both on Earth and in space. To develop our machine, we have formed partnerships with leading biomaterial production facilities and have participated in biotech accelerators. Synbiot was founded with a vision to make science more accessible. With Ismat's biochemistry and bioprocess design background, my commercialization and industry experience, and our multidisciplinary board of advisors, we have the capability to build this. Currently, we are raising to achieve our MVP development in the next 12 months and are seeking partners who are aligned with our vision of making biotechnology more accessible. We would love to stay in touch. Please reach out if you're interested in building a future of more biopharmaceuticals for less.
Each year, over 12 million people suffer from chronic wounds. They experience pain, discomfort, and at risk of serious complications, such as sepsis and amputation. Hi, I'm Max, co-founder and CEO of Alaso Bio, an early-stage biotech R&D company. The slow healing of these wounds, plus the risks of infection and build-up of antibiotic-resistant biofilms, require frequent checkups by clinicians, costing $56 billion each year. At Alaso Bio, we are developing patentable technology that helps wounds heal faster by removing bacteria while simultaneously enhancing the body's natural healing processes. We're doing this by combining the proven capability of bacteriophage with an immune modulation agent. We're the only player in the market with a solution that combines the effective management of highly resistant bacteria with the promotion of rapid healing, which is our core advantage. The total annual spend on chronic wound management in Australia, UK, USA, and Europe totals $56 billion. By licensing our product to a major pharmaceutical company, we are aiming to service 20% of this market and capture 10% of the current spend, which is $1 billion a year market opportunity. To help realise this huge opportunity, we are partnering with clinical and scientific centres of excellence. We are currently engaging with the University of New South Wales, Australian Research Council supported centres of excellence in both synthetic biology and biofilms, and clinical experts in bacteriophage therapy and chronic wound treatment. Initially, this takes the form of research collaboration based in laboratories out of the UNSW for the completion of our proof of concept studies. The team driving this groundbreaking technology is Dr. Hubert Majeur and myself. I have a Commerce degree in International Business and a Master's of Science in Biomedical Technology, and have had personal experience with clinical bacteriophage therapy. Dr. Hubert Majeur has an extensive research background and expertise in early-stage commercialization of medical and life science technologies. We have a world-class team of advisors. Dr. Sandra Morales is the ex-VP of Research at Amplify, a global bacteriophage company. Dr. Bernie Hudson, who is the Head of Infectious Diseases at Royal North Shore Hospital, and an expert in clinical use of bacteriophages in Australia. Dr. Malcolm Ball is a biofilms and glycobiologist with experience in bioproduction processes. And Dr. Zemfira Alavidze worked for over 40 years at the Eliava Institute, the foremost centre of bacteriophage expertise. To date, Elasto Bio has received just under $100,000 in investment, including from the George Institute and University of New South Wales. We are planning to open our seed round in January 2022, upon completion of our proof of concept study. At this time, we are looking to raise $500,000 to complete our prototype development. If you'd like to be part of solving the problem of chronic wounds, please get in contact with us.
Atomy is an automation SaaS that enables the rapid creation of packaging and labeling artwork without error. Now at its core, Atomy is a story of human impact and its effect on industry and producers. To get to market, packaging and labeling must be 100% brand, regulatory, and production compliant. You get even 1% wrong and it's a big problem. Mistakes cause massive time, cost, and brand impact. For medical packaging, this is even more serious. Errors have major human impact, fatalities can and have happened. Due to this, labeling errors lead to major action. A designer's inserting a wrong ingredient can lead to a $40 million impact to the producer. To reduce risk, producers put together a process that looks like this. Briefs get put together, they go to internal or external artwork teams, then checks, then changes, then more checks. This process takes between 1 to 6 months. Trying to reduce the number of resources or time can lead to more errors. Producers will not do that. The solution, the Atomy way. Agility to market without the risk. The brief pre-fills and pulls and verify data and design assets, a creation engine that puts the artwork together, working with 3 rules engines for brand, reg, and production compliance. Instant artwork. The approvals are enabled across all stakeholders. Reg teams can review and approve, marketing teams can test instant changes and make decisions on the fly. Value for producers is immense, and they're reducing cost, time, and brand inconsistency. But think about the revenue gain possible from getting your products on shelf 1 to 6 months earlier than before. Atomy is a simple to use front end with some very complex and greenfield technology behind it. We are building novel IP and have locked in partnerships with AI Research Center CIC in Spain for Swarm AI, UNSW School of Computer Science and Engineering for AI, RP and blockchain. In stage 1, we are targeting multinational pharma and medical entities. We have also got inbound requests from food and alcohol CPG multinationals. Our market expansion is through these multinational clients, entering and consolidating reg environments one by one. We will also look at product expansion to cover other areas like food, alcohol, ag chem, skincare, and more. We have healthy unit economics with a SaaS rev per client calculated between 60K to 1 million. Now for the human equation. I'm a programmer turned award-winning creative director turned brand transformation strategist who has worked on this problem with some of the world's largest brands. My co-founder Paul has 30 years of dev leadership experience across some of the largest global tech companies. We have put together a senior leadership team with global experience and have activated research and development partnerships with major players. Our advisors are global leaders who contribute a wealth of experience, provenance, and their strategic networks to Autonomy. Our ask, investors, let's talk. We're at our 800K round and we're already 40% done. For clients and industry connectors, let's talk synergy. Thank you.
For the past few years, my co-founder Mark and I have been consulting leading private clinics to bring in patients and form better experiences. Speaking to one of our clients, we learned about Hannah's true story. Hannah had a tummy tuck. Her procedure went well and she was discharged with a photocopied care plan for the next 4 weeks, a sheet of paper with dot point instructions. 1 week post-op, Hannah noticed inflammation around her wound and referred back to her care plan where it mentioned minimize activity and rest. After struggling to get in contact with her clinic and asking online, she decided to ignore the pain, and 1 week later, she was rushed to theatre for her wound to be cleaned and restitched. This story and struggle is real, and Hannah isn't alone. At Pantea, we've discovered hundreds of unheard stories from patients like Hannah who deserve better care, and clinicians agree with us. Looking at Hannah's story, we realized the true impact on our existing clients. We discovered that every single negative patient experience like Hannah's may lead to a revenue loss of up to $75,000 per year. For one of our clients' clinics, this potential revenue loss was up to $1 million per year. Working with clinicians, we created Pantea, a platform for private clinics and patients specialized in clinic optimization and patient engagement, combining monitoring, education, and communication. Following Hannah's first appointment, she connects to her clinic and tracks her health with detailed insights into her recovery. She's assigned education modules to improve her understanding, which saves her clinician time in consultations. And now she's able to communicate with the clinic to provide updates and ask questions. After consulting leading clinics, we understand that insights and optimization is a key selling point. Each procedure monitored with Pantea creates valuable insights, and across the network builds Pantea pathways offered back to our clinics as well as patients around the world to self-manage their recovery. We employ a subscription model, charge to private clinics, and generate further revenue through our patient self-monitoring app, consulting, data licensing, and in-app purchase referrals. We have an attainable market of $2.1 billion with a goal of $212 million per year, capturing 1% of patients and 0.2% of clinicians performing elective surgeries with a focus on plastic and cosmetic. Compared to our competitors, we focus on elective surgeries and private clinics with a patient self-monitoring app. Our competitive advantage lies in our procedure-specific protocols, predictive insights, and Pantea pathways offered back to our patients. To date, we've generated revenue through our existing clients, and our clinic MVP trials are launching later this year. We've secured investments and are forming partnerships with leading organizations who see the benefits of Pantea in healthcare. Our go-to-market strategy focuses on clinic trials to develop case studies within the plastic surgery niche, powered by our existing network of clinics with the potential for rapid growth via referrals. We'll be launching globally in network-relevant countries through partnered clinics and patient self-monitoring. What we believe in most, though, is our team. Driven by our personal experiences with healthcare, our vision is to create a world where every patient is connected to their health. Mark leads development and operations, and I lead product and client relations. We've formed a strong digital health tech team who understand what it takes to develop a secure product, and we're backed by our medical advisors who help bring Pantea to life from day one. We're currently raising, and we'd love for the UNSW community to join us on our journey.
And that brings us to the close of tonight's event. Congratulations to all the teams, and thank you once again to everyone who supported the 10X and Health 10X Accelerator programs. We look forward to your continued support.